Hi viewers, here in this video we are going to see few weight loss methods that are currently available in market. Let's see them. Method 1. Weight loss surgery, preventing the health risks. If you have been watching your weight go up and you are worried about the rising pounds, you may be wondering whether weight loss surgery really works. Is it possible to prevent future weight gain by putting yourself on a well-known weight loss surgical operation? Today, weight loss surgeries are gradually gaining recognition when it comes to losing weight. Many health experts contend that people who are excessively overweight or has slower metabolism would normally require some surgical operations. Surgery at present. The greatest progress in the care of the surgical patient has taken place since the beginning of the present century. An increasing knowledge of disease and disorder as a result of research has permitted the development of many diagnostic aids. Some of these depend upon röntgenograms, laboratory procedures such as chemical, bacteriologic, and pathologic determinations, as well as monitoring devices and computer aids. Hence, the result is that the diagnosis of disease and disorder is made with more exactness and certainty than was possible from the simple clinical examinations of previous days. That is why people who wish to undergo weight loss surgery should no longer be afraid of the procedure, because high clinical standards are now being implemented in every surgical operation. The concept of weight loss surgery. Health experts contend that weight loss surgery is a major surgery. One of the most common reasons why people would like to lose weight is to enhance their physical attributes. However, it should not be the underlying motivation that they should undergo the process of weight loss surgery. What people do not know is that weight loss surgery is especially generated to help obese people live longer, healthier, and better. That is why it is important for an individual to meticulously analyze his or her situation, do some research about the process, and analyze if weight loss surgery is the ultimate choice for his or her physiological condition. Moreover, it is important to gather further information about weight loss surgery by consulting an experienced and knowledgeable bariatric surgeon, or even just an expert family physician who knows the ins and outs of weight loss surgery. In addition, the patient should also consult the other health experts such as the psychiatrist and dietitian with regards to some psychological advices on long-term goals after the operation. Generally, patients who have undergone weight loss surgery are said to be successful if they were able to lose 50% or more of their extra body weight and will be able to maintain that condition for the next 5 years or so. However, the results of the operation may still vary depending on the clinical information of the patient and the skills of the bariatric surgeon. Normally, the patient will be able to lose at least 30% to a maximum of 50% during the first 6 months after surgery, and within the year after the operation, the patient has the potential of losing weight up to a maximum of 77%. Best of all, people who were able to lose weight through surgical operations can actually maintain a continuous weight loss of up to 50% to 60% in the next 10 to 14 years after surgery. Factors to consider. As with the other weight loss management programs, there are many factors to consider before the patient should decide to undergo weight loss surgery. Consequently, the actual weight that will be lost is reliant on the weight before surgery, surgical procedure, patient's age, capability to exercise, total health condition of the patient, dogged determination to maintain the necessary follow-up nurture, and the enthusiasm to succeed with the help of their family, friends, and their colleagues. If you have just put on a few extra pounds and want to avoid gaining more, these weight loss surgeries for better health may seem convincing. But, in addition to being convinced, you may also have to take some action to ensure that your weight does not creep upward. Therefore, it can be concluded that losing weight is not just a question of deciding to be strong-willed and determined or upbeat and positive. Lifestyle changes are where it is at for long-term success with your weight, especially after weight loss surgery. Method 2. Tablets to help in weight loss. Recent studies have shown that more people are getting overweight every year. This happens not only to adults but even to kids who have just started in school. There are many factors that have contributed to this, such as the rise in the number of fast foods joints that contain a lot of saturated fat in the meals, the use of refined sugar in sodas and other processed foods, eating food with less fiber, genetics, overeating, and as people age, slow metabolism. Since losing weight takes time and most people can't wait to get rid of it, these people have decided to take the fastest way out, which is through the use of weight loss tablets. In the 1950s until the late 90s, doctors prescribed drugs for weight loss. The drug works by increasing the serotonin levels in the brain that makes the brain believe that the stomach is already full and thus increases the person's metabolic rate. It was only after scientists discovered that these drugs had side effects and were related to cause heart valve disease that these were taken off the shelves. Later on, modifications have been made and new drugs were developed and prescribed by doctors, and many of which are still waiting for FDA approval. The idea that a simple drug can change everything without the need to change one's diet or sacrificing anything is very tempting, since people have seen friends and family members use it and have shown tremendous improvement. This has made a lot of people spend millions of dollars every year to also experience this miracle, and has given drug companies a lot of money making the drug and selling it. Diet pills can be purchased either over the counter or prescribed by a doctor. Even with the advances in medical technology, these drugs still pose a health risk to the public. Problems in patients can be unpleasant, such as diarrhea and vomiting, harmful such as tightness in the chest and in the urinary tract, and fatal such as a heart attack or a stroke. An overdose in using weight loss tablets can cause tremors, confusion, hallucinations, shallow breathing, renal failure, heart attack and convulsions. The side effects vary depending on the lifestyle and health of the person, and can be minimized as long as one consults the doctor and follows the prescribed dosage when using it. Should one decide to stop using the drugs, studies have shown that a person will experience withdrawal symptoms and side effects. These include noticeable mood swings, hyperactivity, and pain in the stomach, insomnia and nightmares, severe irritability, extreme fatigue, depression, nausea, vomiting and trembling. A lot of clinical tests will show that taking this weight loss tablets really work. But this can only work if it is done with a low-calorie diet and an exercise plan. A person can jog every morning or sign up and work out in a gym. Just like taking any medicine, one should first consult the doctor before undergoing any form of exercise. The best exercise plan should have cardiovascular and weight training exercises. This helps burn calories and increase the muscle-to-fat ratio that will increase one's metabolism and lose weight. It is up to the person already to stick to the program to see that it works. Method 3. What there is to know about diet pills. According to manufacturers, diet pills use natural ingredients capable of prolonging life and containing alcohol used in medication or flavoring. One thing's for sure, never take diet pills as substitute for cutting calories without the doctor's recommendation. There are simple but important steps to be followed when taking diet pills. 1. Never crush diet pills to mix in drinks or soups. Take it whole with a full glass of water. 2. Diet pills causes a person to urinate more frequently due to its diuretic effect. This could lead to dehydration, thus causing complications. As a precaution, it is best to drink 8 glasses of water every day while on diet pills. 3. Take only the recommended dosage. Taking more than required will not help you lose weight but increase the risk of side effects. 4. Heartbeat should be less than 86 beats per minute. Stop taking the pills if it reaches 90 or higher. That is why regular checking of pulse is a must. 5. Always follow the instructions set by the dietitian and/or doctor, and not only rely on what's enclosed in the box. Also, diet pills will only work as expected if diet plan is being followed. 6. After 3 months, stop taking the diet pills. Common diet phenylpropanolamine is safe to use only up to 16 weeks. Other studies show that it can cause health problems if taken under 1 month. There are 2 kinds of diet pills. One is the prescription-only diet pills and the over-the-counter diet pills. Prescription diet pills are drugs regulated by the Food and Drug Administration Agency, which side effects are monitored, may be advertised and prescribed under certain dosages. The most popular of these is Xenical, which is licensed for long-term use. However, this too has its own side effects. Diarrhea, oily and unexpected fecal discharge are just some. Therefore, users are advised to take a low-fat diet plan. While over-the-counter diet pills are categorized as food substitute and are unregulated. Beware that these diet pills are not federal authorities tested and may cause serious side effects up to and including death. Aside from a dietitian, local pharmacists can also help in determining the pills that are safe and not for each person's case. Just be extra careful about the so-called natural or organic ingredients. Not everything that comes from a natural source is safe. One example is mahuang, which is a botanical source of ephedrine known as a stimulant and being studied for potential side effects. Those who have or have a family history of prostate problems, thyroid disease, mental illness, high blood pressure, and heart problems should avoid taking diet supplements. The same applies to those who've had seizures or strokes. If someone is taking cold medicines, especially those with decongestants, diet pills should not be taken. Whether it be a prescription or an over-the-counter diet pill, the dangers are unvarying with other similar drugs which controls the brain to reduce appetite and includes chest pains, hair fall, fever, depression, and even impotence. And as a general rule, don't ever try to take diet drugs if pregnancy is suspected. Persons that are allergic to sulfites and tartrazine should also avoid taking diet pills. And those who are under 18 years or over 60 years of age should consult their doctor first prior to taking any dietary drugs, especially if they rely on over-the-counter stimulants used as a replacement for increased exercise. Method 4. Nutrition notes on weight loss supplements. More and more spend hundreds and even thousands of dollars yearly on weight loss supplements in the hope of speeding up their metabolism. The main desire is to be attractive and accepted, but it is becoming a more difficult goal to achieve. The fitness industry is booming, but still a lot of people are unable to cut those fat in spite of all the exercise and diet efforts. In America, more than 60% of adults are overweight and 30% are considered obese. This is because 1. A lot of weight loss products promises unrealistic goals, 2. Dietary supplement manufacturers rely on the overweight person's failure to survive, and 3. The information about the supplements in the market are just written by themselves just to make a sell. Although the Food and Drug Administration has successfully banned illegal marketers, some products are still available. Consumers can be deceived of the labels which claims caffeine or ephedrine, not knowing that these supplements composes of other ingredients that may pose the same health risks. These include heart and digestive problems, headaches, insomnia, and even psychological side effects. Other supplement manufacturers say that the products contains EGCG, which is a phytochemical ingredient found in green tea. This so-called component claims to speed up metabolism, but in reality poses to reduce the risk of cancer. Some studies denote that it could slightly increase the potential to burn calories and now can be found in many weight loss supplements. It has good points on the other hand, since the body might conform to EGCG after a period of time. Even the weight loss benefit could sum up to 60 to 70 calories a day. This helps prevent excessive weight gain. A few other significant effects of weight loss supplements is that it may contain ingredients that makers claim will prevent the absorption of carbohydrates. One good example is chitosan, which appears most promising, which in fact shows no positive result in fat absorption. It could even take up to 7 months for men to lose just a pound of body fat, and for women, there is no fat loss at all. Thyroid supplements act as thyroid replacements, help regulate and optimize the thyroid at a higher level. This, they say, makes the body feel like a couch potato and won't perform the job it has to. Since the number one reason why people eat is because they feel hungry, there is another type of ingredient that manufacturers made which increases the feeling of being full and decreases appetite, guar gum. However, recent studies show that it has no meaningful benefit at all to weight loss. It is ironic that manufacturers mix psyllium, that has the reputation of reducing eating and aiding weight loss. For initial studies so far do not support this claim, although it helps control blood cholesterol and sugar. One of the latest innovations in the fat loss industry is by way of skin absorption. There's a cutting gel, which is an epidural product, by far the best-selling in fat loss creams technology. Rub it where you want the fats cut. For now, it will seem safer to advise the age-old remedies to excessive weight gain, and that is to invest on walking shoes instead of diet supplements, go to the park and do brisk walking, go to the gym, and have a well-balanced diet instead. Method 5. Pointers on losing weight safely. People who want to lose weight commonly, and first of all, think about reducing the amount of food they eat. This may be quite a solution, but not exactly the best there is. In fact, depending on the amount you reduce in your food intake, it may even be dangerous to one's health. So how does one lose weight effectively and safely? Here are some points one should consider when trying to lose weight. Beware of the crash diets. Most people think that trimming down the calories can alone shed off their unwanted excess. Probably this is because of the fad there is in advertising about low-calorie food products and beverages. What people don't know is that this could be dangerous, because when they decrease their calorie intake way to below the required levels, the body begins to digest the fats. Sounds good, but it doesn't actually. Burning fat requires a lot of energy. Since there is not much energy in the body to facilitate metabolism of fat, it will run at a very slow pace, resulting to fatigue, illness, and weak immune system. Low-calorie diet is also compensated for by the body by burning muscle. People on this type of diet who revert back to their old eating habits end up gaining back some, if not all, the weight they have shed off. This would consist mainly of fats. And since fats have more volume per mass than muscle, they end up having the same weight as before but more bulkier. In losing weight, one should keep in mind that they should lose excess body fats only. However, one can try out eating small meals at more frequent intervals. This way the body will not think that it is being starved and will not store food as fat. Eat properly. One may have considered junking the crash diet option, but he should also not forget to watch what he is eating. Variety must always be considered so that one may be able to get the necessary nutrients from his diet. It is also healthier to eat food which are roasted, steamed or broiled rather than fried. It is also important to include a lot of fiber in the diet. Frequent rehydration is also necessary. Pump up lean muscle mass. Muscles burn calories when they work, they even do so at rest. Unlike fats which just lie around, bulge around the pants and dangle beneath the sleeves, muscles burn calories all day round. With this fact, one can start weight loss by increasing muscle mass. The more muscles, the less fat will be left. This is attainable starting with working out with resistance exercises. Engaging in aerobics. Aerobics are not only good for the heart by increasing cardiovascular endurance. Aerobics also help in increasing lean muscle mass while simultaneously decreasing excess body fat. Aside from these, aerobics make the metabolic process more efficient and its rate high, even after a long while. Imagine burning fat efficiently while driving along the freeway or even while watching television. Extra push. Some people believe that smoking and caffeine can actually help in losing weight. This can perhaps be true, however, they do the body more harm than good because of their side effects. For that extra push, one can try out taking food supplements. After all, 95% of these products out in the market actually does good. On taking diet pills. Over-the-counter diet pills affect the amount of weight one loses as well as how long one keeps that amount of weight off. However, one must be wary of the side effects of these diet pills. As such, one must faithfully follow the instructions provided for in the packaging. It is also prudent to consult the physician anyway before trying out these drugs and also to find out which type would be best for the individual. Losing weight does not have to mean sacrifice and suffering. It actually means opening up to a more full and healthy life where one may not have to feel bad about himself having to look the way he does or not being able to do what he wants to do. Losing weight might entail a little adjustments plus the discomforts, but as the old saying goes, no pain, no gain. Besides fat, what has one got to lose anyway?